Good afternoon, everyone. Thank you for taking the time to join us for our webinar, COVID-19 Resources from the Maryland Health Connection, presented by Ashley Duckman, Vice President of Government Affairs, Maryland Chamber of Commerce, and Maryland Health Connection's Andy Ratner, Chief of Staff, and Johanna Fabian Marks, Director of Policy and Plan Management. Before we start today's webinar, I'd like to provide information on the Maryland Chamber as well as some helpful housekeeping information. Founded in 1968, the Maryland Chamber of Commerce is the leading voice for business in the state. Grassroots advocacy is at the heart of what makes membership in the Maryland Chamber of Commerce so valuable. On behalf of our 4,500 plus members and federated partners, we advocate for legislation and policies that ensure sustained economic growth for Maryland. Today's call will be inclusive of question and answer. To submit a question to our presenters, please use the chat feature within the Teams events platform. If you have questions following today's webinar, feel free to send them to mdchamber@mdchamber.org. Today's call will also be recorded and available on our website in the coming days. With that, I'll hand it over to Ashley.
Thank you, Marie. Very much appreciate that and the updates on the housekeeping items. We're going to get started with today's webinar. We are very grateful to have Andy and Johanna, who Marie introduced just now from the Maryland Health Connection with us today to talk about special enrollment in the wake of COVID-19 and provide us with some other important information and resources for businesses as it relates to the Maryland Health Connection. Again, as Marie mentioned, we will be moderating a Q&A with our presenters. And so if you have questions throughout the presentation, please submit them in the chat feature and we will try to get to as many as we can. And with that, I will go ahead and turn it over to Andy and Johanna. Thank you.
Thank you very much, and thank you for joining us this morning. We very much hope you and your loved ones, family and friends are getting through this. It's been very difficult, and I think even more, of course, difficult for the people who are ill and facing job loss and business loss. So I think, just we're doing whatever we can so that we can all get through something that's totally unprecedented for us and something that I think even a couple of months ago, none of us would have predicted. Again, thank you for joining us this morning. We'll talk to you a little bit about the special enrollment that we launched about a month ago in concert with this coronavirus emergency. Next slide, please. So Larry Hogan on March 11th had said that, even though the federal marketplace that oversees, handles about 35 states, that is not planned to reopen, the dozen or so states that have their own marketplaces, many of them have reopened. We were one of the first to do so for people to get coverage on the individual market if they had lost their coverage. Last week, we extended that until mid-June. It's important. We always tell people that, even if you're healthy, you never know what's around the corner. And certainly this pandemic raises that for a lot of people. They certainly didn't expect this coming around the corner. Next slide. These are the dates for people to enroll, and in the next few slides we'll tell you how folks can enroll that who don't have coverage, and how it might help even employees or employees who have lost coverage. If people enroll by April 15th through Maryland Health Connection.gov, I apologize, that's my 5-month-old grandson in the back, I think running these. One of these telepresentations from home has become an extra special challenge. If you enroll by April 15th, the coverage will actually predate and begin on April 1st. For people who enroll between April 16th and May 15th, the coverage will start on May 1st. And people who enroll between May 16th and June 15th, when the Corona Special Enrollment Period ends, their coverage would begin June 1st. Next slide, please. and how to enroll. There are several ways. The easiest is to go to Maryland Health Connection.gov. We also have a mobile app on both Android and iOS, Enroll MHC, and you should request or select Coronavirus Emergency Special Enrollment Period when you do enroll. We also have a call center available from 8 a.m. to 6 p.m. weekdays, and that number is on the screen, 855-642-8572, and we have help available in more than 200 languages. You know, we understand that a lot of people remember when the website crashed initially, but we've been very proud of what we've built, you know, in the 6 or 7 years since then. I think the website has been much refined, and the mobile app is frankly one of the best in the country. You'll see in some of the next slides when you have to verify a document, a pay stub or something like that, you can take a picture with the mobile app just like you would a check from your bank to deposit it, and work it that way. So I think we've made a lot of strides in improving the user experience and the technology for Maryland Health Connection. Next slide. So what would folks need to apply? They would need their birth dates, they would need their social security numbers, they might need their proof of citizenship or immigration status, tax returns for prior years, their employer and income information such as pay stubs or W-2 forms, policy numbers for any current health insurance, and information about any job-related coverage for which you or someone in your household is eligible. The reason that's important is if someone has an offer, has even not accepted the offer of employer insurance, that might keep them from being able to get financial help for an individual policy on Maryland Health Connection. Next slide, please. So what is covered under the Maryland Health Connection plan? As many of you have heard, health insurance companies are required to waive many costs involved with coronavirus testing, the cost sharing, lab fees, co-payments, coinsurance, and deductibles for any visit to test for coronavirus at a doctor's office, an urgent care center, or an emergency room. You can qualify for the Coronavirus Emergency Special Enrollment Period even if you're not sick. In fact, you know, we set it up specifically so that you didn't have to show any symptoms or anything like that to be eligible. All uninsured Marylanders who are eligible may qualify for this special enrollment period. And again, largely the groups of people who might not be eligible would be people with legal status issues, or again, if you had an employer offer of insurance that you hadn't accepted that was deemed affordable, that might keep you from getting you know, financial assistance and being able to enroll through Maryland Health Connection. The importance of having insurance is that you don't know when you walk in what's going to happen next. So you're not quite sure, you know, you can't know what it is that you're going to necessarily be tested for, or what medical professionals would find. So, you know, you just don't want to put yourself in a bind. Next slide, please. And this is to give you a sense of how many people have enrolled since we launched this coronavirus special enrollment on March 16th. There's been more than 13,000 people who have enrolled. About half of those are on Medicaid, and we have more information on the website as well as on the slide in terms of sort of what would qualify you for Medicaid in terms of your income. A little less than half of the people enrolled during the during the coronavirus special enrollment are on private plans, qualified health plans through the two carriers that serve the individual market, Care First and Kaiser. About 2/3 of those people were eligible for financial help in the form of advanced tax credits. And the way those work is, depending on income, you will get a tax credit to eat into the monthly premium that you would pay for your health insurance. It's, you know, the good thing about it is you don't have to wait till the next April to settle up with the government on it. Those tax credits are calculated in advance and sort of lower the out-of-pocket cost you would have every month. The important thing, and it's particularly important during a time like this when people's incomes can fluctuate so much, is just to make sure you're up to date on your profile on your account or through the call center in your account with what your income is. Again, it works similar to what you're used to on, say, deductibles, or what you're used to, say, in withholding for your taxes. If you don't take out enough withholding, you know, you'll have a heavier bill come next April. If you have more than enough withholding, you might get a bigger check. It's a, you know, similar kind of thing. If you have more credits and you haven't adjusted your income, let's say you are making more money, you may have to pay back some of those credits that you've received in advance. But it's important just that you keep your income levels sort of up to date in the system. But the financial help can help a lot. I mean, it's, you know, people talk about the cost of insurance. You know, it can knock the cost down by several $100s a month or more, depending on the household size and income. The next slide. And this is, I know, you know, a lot of the people that we're talking to today are, I would consider, thought leaders in the community. So this is just to give you a sense, a better picture of sort of what the story was in Maryland. This may have changed a lot in the last 6 weeks, but before 2012, about 12% of the population in Maryland did not have health coverage. 6 weeks ago, that figure would have been 6% didn't have LAC coverage. Again, you know, a lot has probably changed. About 430,000 people have been covered in Maryland, you know, since the Affordable Care Act took effect. About 315,000 of those people were on the expansion of Medicaid, and about 120,000 of those people were on private insurance that received tax credits. There's probably another easily 120,000 people who are also in private health insurance, either on the exchange or off the exchange, again, through those two companies, CareFirst and Kaiser, who don't receive any financial assistance, generally because of their household incomes being too high. So that leaves about 403,000 people who remain uncovered in Maryland. And again, you know, this was before, you know, the pandemic that has sort of transformed the economy for now and probably for some time going forward. Of those 403,000, about 188,000 would be eligible for free or low cost coverage, but just hadn't gotten the message, or maybe they just didn't still consider it affordable, or maybe they just wanted to roll the dice. But about 106,000 of those adults would be eligible for subsidized private plans. 57,000 of those adults would be eligible for Medicaid, and 25,000 children would be eligible for Medicaid or subsidized private plans. The remaining 215,000 of those people who are uncovered would not be eligible for financial help, but they might be able to benefit from, you know, small group plans, depending on, you know, if their employers were able to offer them coverage. Many were ineligible because their incomes are too high, above 400% of what is known as the federal poverty level. But more than half of those people would not be eligible for other reasons, as we discussed a little earlier, including you know, legal status, being unlawfully present. Next slide. And I'm going to turn it over in a second to Johanna Fabian Marks, our Director of Policy. I just want to say that job loss is typically a qualifying life event for a special enrollment period. So even before coronavirus, you know, if someone had lost their job, gone through anything from a divorce to marriage, other life changes, that would open about a month-long window for them to be able to enroll outside of the enrollment period that typically runs from November 1st till December 15th. This coronavirus period, and we also have another one that had opened up for the first time ever anywhere related to state taxes. If someone checked off on their state tax form that they lacked insurance and wanted information, that might also open a month-long window for them to enroll. The alternative for employees, particularly if they lose their job, is often COBRA. And that can be very expensive. They often have to pick up the full cost, at least after a short while, perhaps. And the coverage wouldn't necessarily be comparable. And if they do enroll in COBRA, they'd have to wait up to 18 months before they could enroll in a Maryland Health Connection plan. So anyone who is facing loss of coverage should definitely check out Maryland Health Connection.gov to see if they can find something that'd be cheaper. And any business that is cutting staff or expecting layoffs and wants to schedule an event for their employees, we'd be happy to coordinate a presentation, including with the Department of Labor to discuss employees' insurance needs. Next slide. I'm going to turn it over to Johanna Fabian Marks to talk a little bit about the small group insurance. As you probably know, basically health insurance comes in. It's related to your job. It's related to the size of the organization you work for. You're either in large group for a large business, small group for a small business, or the individual market if you're self-employed, work for yourself. And that certainly has come about and been very obvious sort of through what we've gone through now. That's not how your car insurance works. It's not how your life insurance works, but it is how your health insurance works. So while we have done a lot, and the Affordable Care Act has done a lot to try to plug some of the gaps in the individual market, I think it's been more difficult for the Affordable Care Act to make gains in the small group market. But in Maryland, I think we've tried to turn more focus to that area to see what we can do to improve it. So Joanna can talk a little bit about a survey that we conducted last summer and some of the other things that we're trying to do to make the small business element of Maryland Health Connection improved and a better option. Take it away, Johanna.
Thank you, Andy. Yes, and so as Andy was just saying, in terms of the distinctions between the large group, small group, and individual market, this portion of the presentation will focus on what we are working on for the small group market. And by that, we mean businesses with 50 or fewer full-time equivalent employees. That's what we consider small businesses for the purposes of health insurance in the state. What Andy had previously discussed regarding coronavirus special enrollment period is applicable to the individual market. So if you're a self-employed individual or you have employees who you do not offer health insurance to, but who are looking to get coverage or who have unfortunately been recently laid off and need coverage, any of those types of individuals could get covered through the coronavirus special enrollment period in the individual market through Maryland Health Connection. We also operate Maryland Health Connection for small business, and this is focused on helping small business owners who want to offer insurance through their business to some or all of their employees. And as we've been building out Maryland Health Connection for small business, we've been working to engage the small business community to make sure we understand what their thoughts are around around offering health insurance, what obstacles they're facing, and what we can do to help. So we commissioned a statewide survey in 2019 of small business decision makers, and that survey investigated knowledge of the Small Business Health Options Program, or SHOP. This is another term for the coverage that we offer through Maryland Health Connection for small business. And we were also looking at the attitudes and motivations about offering health insurance to employees. We got nearly 200 responses, most from businesses with 10 or fewer employees, and those survey results are available online, but I'll give a brief overview of them and we can move on to the next slide. So this will probably resonate with the folks on our call, but we heard that small businesses certainly do see value in offering health insurance, and that some of the major reasons that they are interested or do offer health insurance to their employees include satisfying employee demand for coverage, understanding that investing in employees is an investment in their business, and attracting and retaining talented workers. Next slide. And we also heard that cost is a major impact, unsurprisingly, that employers are worried about the potentially higher variable cost of health insurance premiums over time. They're also concerned about the upfront costs of providing health insurance, and they face the complexity of understanding the health plan options available and how they're structured. Next slide. So on both of those fronts at the state, we're working to address those concerns related to cost and complexity. We currently have the Maryland Health Connection for Small Business website live now, and that allows employers and brokers, if you're working with one, to compare small business health insurance plans and get quotes online. So you can see how coverage compares across plans and what the premium would be like compared across plans. However, our website does not currently support enrollment. So you can get that comparative information, pick a plan that you're interested in, but then you or your broker would have to work directly with one of the insurers that offer insurance plans in the small business marketplace to get enrolled. So right now our website is informational, really. We are, however, working to launch an updated version of Maryland Health Connection for small business later this year, which would allow employers or your broker, if you're working with a broker, to select and enroll in a plan online, and then to share that plan with your employees, who would then also be able to enroll online through Maryland Health Connection. So you would create an account, select the plan or plans that you want to offer to your employees, select how much you want to contribute towards their premium, and then the employees would also log in separately, see what their options are, and we'd be able to enroll. So that will hopefully help to address that concern around complexity. So this will be an interface that's similar to what we currently offer on our regular Maryland Health Connection website for the individual market, where you can currently go on there and enroll and select a plan. We want to offer a parallel version for small businesses that want to offer coverage. And understand that this may not, if you're not currently offering health insurance, now may not be the time that you want to start doing that and taking on the additional expense, but wanted to make sure that you were aware that this website currently exists for plan comparison purposes, and that it will be available in the future to support direct enrollment if you are interested in doing that in the future. But for now, if you want to get covered through your business, as I mentioned, you can use our website to compare plans and then enroll directly with the health insurance company, or as Andy discussed, you and your employees can enroll as individuals through the regular Maryland Health Connection interface. Next slide. And yeah, I think that's it, but we're happy to take questions.
Great. Thank you to Johanna and to Andy. I think that was great information, and I think all of our members who are on the phone will greatly benefit. I'm looking in our chat feature, and I'm not seeing anyone who has posted a question there. I'll give folks just another few seconds to see if there are any questions that populate in that chat feature. And I will also just point the folks on the call. I know any of you who have been regularly participating in our webinar series or in our COVID-19 working group know that we are constantly touting our resources page at the Maryland Chamber of Commerce, which you can find by going to our website. We really are using that as our main landing page for any and all information as it relates to COVID-19 and response, big and small. This presentation and the recording from this webinar will live there as well in case you need to refer back to it. And I would encourage also for those of you who are business owners on the call as well, to regularly also visit Maryland's interagency landing page, businessexpress.maryland.gov. Another great place to get up-to-date real-time information on resources as they become available, as they change, as they evolve. So I would definitely look to both of those pages. And I would also say that we at the Maryland Chamber of Commerce continue to be here and on call and ready to assist with whatever challenge emerges in your specific business area. We can connect you with the appropriate folks either in state government or elsewhere to help try to address some of those issues. So with that, again, not seeing any questions coming through, but did want to thank Andy and Johanna for their time. And if there are follow-up questions, please let myself or Marie Rao know, and we can connect you with Andy or Johanna after the fact. But we very much appreciate it and hope everyone stays safe and healthy. Thank you.
Thank you very much for your time, and stay well.